Uh, Hi there. Welcome to Elemental Software's presentation on maximizing the impact of social prescribing through digital innovation. We're delighted to be given the opportunity today to speak at Innovation Week. A little introduction to myself and co-host Dana Taggart. So I have been working with Elemental for almost 2.5 years, specifically within the implementation team to ensure our projects are a success and ensuring that Elemental's customers have a full understanding of the functionality that's available across all Elemental products to help maximize their social prescribing projects. And I'll now pass you over to Dana.
Hello everyone, I'm Dana and I have been working with Elemental almost 3 years within the product team to ensure our digital social prescribing technology works now and in the future with the adoption of ever-changing needs. And with this, we're continuously listening, improving and delivering features and functionality that our Elemental customers need.
Here's a little overview of what we will be presenting today. These focus points will showcase how digital innovation has had a positive impact on the social prescribing model of care. To begin, we would like to introduce you to our Managing Director and co-founder, Jennifer Neff, and our Operations Director and co-founder, Leanne Montgosko. Jennifer and Leanne met in 2013, and at that stage, they were both working in community development and shared the growing frustration that not everyone in the community had the same opportunities to access health, education, and welfare services. They believed with their combined experiences, paired with a powerful vision to create connections and improve lives through digital solutions, something special could happen. It was then Elemental was born. So what is social prescribing? Social prescribing is a model of care that enables health and social care professionals to refer people to a range of non-medical services within their community to improve social, mental, physical health and well-being. And it's also recognizing that people's health and well-being is determined by a range of social, economic, and environmental factors. Social prescribing takes a holistic approach that empowers people to take control of their health, identify ways on how they can improve through a social prescribing link worker. Social prescribing is all about connecting communities, halting health inequalities, and building strong networks, opportunities, and being the voice of your locality and region, and having the ability to make your own choices on health and well-being. So why was Elemental founded? We share with you the 5 main reasons behind this innovation. So 1, they help promote better partnership working. 2, they make a significant contribution to health inequalities. 3, they help maximize the impact of population health management. And 4, they provide a co-designed pathway with individuals at the center. And 5, they help demonstrate the impact that the voluntary and community sector organizations make. So what is Elemental? We are an award-winning Tech for Good company. Our digital social prescribing platform helps localities and regions to establish, scale, and better measure the effectiveness of social prescribing model of care. And we're a team of passionate professionals who really care about halting health inequalities and improving lives within the community. We provide the technical connectivity that's needed for multi-sector partnership working, leadership, and the measurement of mobilization of community support. We have a continued growth of customers across all sectors throughout England, Ireland, Scotland, and Wales, and we're absolutely delighted to say that 95% of our existing customers renewed their contracts. Elemental is a cloud-based and responsive platform with two-way integration with all major UK clinical systems that enables you to establish, scale, and measure the impact of social prescribing. We have a combination of 7 products and services, which are Elemental Core, Elemental Connector Plus, Elemental Population Plus, Elemental Analytics, Elemental Open Directory, Elemental Integrations, and also Elemental Consultancy. All products and services are used across 7 key markets in England, Ireland, Scotland, and Wales that include education, both uni and FE colleges, health, so health and social care trusts, GP practices, primary care networks, and GP federations, housing within private and social housing, employment, voluntary and community sector, whether that be local and national charities, and also local governments, both county and district councils, and prison care. Elemental enables allied health and social care professionals to review and evaluate each point within an individual's health and well-being journey. This is an example of how one individual's journey could potentially look, but it has been adapted and adjusted across multiple different sectors. So at step 1, the referral agent, which typically is a GP, will generate a referral, or a client themselves can self-refer directly into a social prescribing project. At step 2, the social prescribing link worker will receive the referral and make an appointment to speak with the individual. At step 3, the social prescribing link worker will meet with the individual and a discussion takes place around what matters to them. At this stage, the link worker can also capture any well-being measurements. At step 4, a social prescription/well-being plan can be co-created and introductions can be sent directly to the external providers. At step 5, any additional follow-ups can take place, with well-being scores being re-recorded and additional support being provided at this stage. At step 6, you can analyze the individual's progress, where you would hope that their health risk is reduced, whether that would be the anxiety levels being lower, the individual feeling less isolated, more physically active, or reducing health risk or another chronic illness. At step 7, you can analyze the results of the collective and the contribution you have made to creating more engaged, activated, empowered, and mobilized patients and communities. Each month, we share analytics from our digital social prescribing platform to showcase how many people are benefiting from social prescribing, how many GPs, link workers, and voluntary community sector organizations are using Elemental, and to provide social support for those who need it most. Here are your statistics for the month of October.
So as COVID was developing, we did what we do best and went straight out to talk and listen to our social prescribing link workers, patients, GPs, social workers, commissioners, housing officers, VCSE providers, and allied health professionals. We wanted to hear about their plans for COVID and what the barriers were for these plans to be implemented effectively. Yes, our product is really dynamic, but it needed some enhancements, so we took the feedback to our development team. So in light of the global pandemic, we wanted to help our customers to utilise the platform the best way possible so that we could do our part in helping to protect communities. Through all this, the features that we have introduced, and by highlighting already existing features, we would like to give you a high-level overview of this today. These are some of the enhancements we have made to our digital platform to ensure our customers' needs have been met over lockdown and the pandemic. We first start off with reasons for referral and reporting. We've updated our core platform list of reasons to include COVID-19, and this meant that the projects could report on the numbers of COVID referrals being referred into their projects. Number 2 is setting up cohort groups and cohort reporting. We created cheat sheets and helped projects set up COVID-19 as a cohort to allow the projects to look at this cohort of people as a whole and identify what interventions are working for them, help to identify possible gaps in provision, and help to identify the health journeys of this cohort of people. The third one is the creation of the self-refer portal. So Elemental Self-Refer helped empower people by making it easier for anyone to instantly request support during COVID-19. The projects were able to add a button to their existing website, which linked directly to Self-Refer web form, allowing clients to directly refer into the project for support. Number 4 was the ability to create new interventions and temporarily removing interventions. So because of COVID, we know that there have been many new community-based interventions popping up as a community response to COVID-19. So the platform made uploading new interventions a simple one-page process. but it also has the ability to temporarily disable any face-to-face interventions to allow these to be activated in the future. Number 5 was reporting on interventions. So when creating an intervention on the Elemental platform, you have the ability to add domains and subdomains. Projects were able to add COVID-19 as a domain in the platform, which then in turn allowed them to filter reports to view the attendance and the impact of these specific group of interventions, as well as drilling into individual interventions. The final point was filtering the service locator and social prescription connector. So when the interventions were created and tagged to the COVID-19 domain, when the referral handlers are then viewing the service locator, they can filter easily all the activities that are still currently active during the pandemic and supporting COVID-19. Elemental saw a huge uptake in their digital social prescribing platform during the pandemic. So nearly 15,000 GPs, nurses, practice managers, social workers and other government staff were now making referrals via Elemental's platform, which in turn helped to reduce GP consultations and A&E attendance. There has been an increase of 288% of social prescribing link workers using Elemental to help them refer, connect, measure and report on individual journeys. So over 132,000 individuals are now engaging in social prescribing programs using Elemental, which means there has been a massive 248% rise of people benefiting from community services since the start of the COVID-19 pandemic. Elemental's Population Plus Lite enables citizens/patients in your community to self-refer and be connected with their social prescribing link worker, reducing the need to go to the GP for referral. So here's a selection of our features with benefits. So the features are self-refer, which allows the social prescribing program to be connected to a local social prescribing link worker. And you can also have an integration, so a button can be easily added to any of their websites, which would link a direct pathway to Elemental. So the benefits are to reach more people in your community, empower your patients, reduce admin time, and build a stronger community. Elemental's Population Plus makes referral route access even easier for your communities via a bespoke website that anyone can request support through at any time on any device. So Population Plus Enhanced is a configurable website that caters for your citizens/patients in your communities with different levels of activation and motivation in order to browse local directory of services, self-refer to a local social prescribing hub and a link worker. They also have the ability to self-serve, so the citizens can measure their well-being, so it might be social isolation, loneliness or mental health, and connect themselves into locally based community activities, which then allows them to have the ability to track and measure their well-being throughout. So again, you will see a selection of our features on Population Plus Enhance with many benefits. So you have browsing the local directory of services, so they can browse what is available in their local area. You have self-serve, so the more activated patients can carry out their own health assessments and follow-up scores and connect themselves into programs and services. They also have the ability to self-refer, so they can self-refer directly into the social prescribing link worker, and they have a configurable website template. This in turn will allow them to reach more people in their community, empower the patients, reduce admin time, and build a stronger community. So customer satisfaction is very important to us at Elemental. We listen to industry professionals and take on board their feedback. So back in January 2021, the Northwest Regional College joined forces with Elemental in a bid to improve the health and wellbeing of students during and after lockdown. So we have a customer testimonial here of Finine Bratley, who is a Cares Academy Manager and Deputy Head of the Learner Services in the Northwest Regional College. We'll go back. So Finine said, the self-refer feature of the platform has been welcomed by staff and students. It enables the students to submit a self-referral at any time, and it's simple to use and students can access it from anywhere. For us, this is a crucial part of the platform and is being used effectively. So the next new product is Elemental Analytics. Elemental Analytics links datasets across sector-specific systems and displays these in a bespoke dashboard. So this provides you with the digital technology to work more closely with your commissioners or funders to build the business case for social prescribing. So Elemental Analytics provides you with comprehensive data on a service uptake, service impact, and community support needs in your region. So it will help to inform how services and solutions are delivered in your region to then in turn support community health and well-being, better connecting people and to their communities. So the Elemental Analytics product consists of a number of interactive dashboards, and this is for commissioners, PCN leads, public health, housing, and local government. Our next customer testimonial is from Ben, who is head of social prescribing at Merton Connected. He shared his experience using Elemental Analytics to help support, enable, and champion the voluntary, community, and faith sectors in Merton. Ben said that Elemental Analytics enabled us to conduct very detailed reports and funding bids. The infographics and graphs are very helpful to present complex data to a wider audience. So furthermore, Elemental Analytics will help to track new social prescribing trends and changes from across the UK. The new software feature will help social prescribing commissioners and managers to plan and produce strategically by utilising local and national data.
So some news, events, and resources. So we share our Elemental newsletter each month in order to highlight what's been happening in the world of social prescribing and what is coming down the tracks. If you would like to contribute to our newsletter, please feel free to contact our marketing manager, Rory Crossan, on roryc@elementalsoftware.co. We also have our monthly Elemental Open Lounge on the 24th of November. This will be the last one of 2021, and it's not to be missed. For more information, visit our website, www.elementalsoftware.co, or check out our social channels. We would like to share with you some of our resources, so feel free to download, enjoy, and share. Myself and Dana and all the team at Elemental would like to thank you so much for your time today, and we hope you enjoyed our presentation. If you would like more information or help to maximize the uptake and impact of digital social prescribing within your area, then please feel free to reach out to us via email, our website, or on our social media channels. Thank you.